Welcome to Circular Firing Squad. I'm Marty, a counseling faculty at Kent State University and host for Circular Firing Squad. We've got 4 members, 4 questions, and 4 answers for each question. Now, each squad member generates a question that we all have to answer, ranging from the scholastic to the bombastic. Let's see who's with us this episode.
Hi, everybody. This is Britt Pollard-Kozadowski. I am a professor and assistant chair in the Department of Counseling and Human Development at Indiana University of Pennsylvania.
Hi, everyone. Elliott Ingersoll, professor of counseling at Cleveland State University, host of Apply Topically, and tonight I have perfected my oven-baked steak fries.
Hey, everybody. My name is Mitch Conrad. I am a third-year clinical mental health counseling student at Cleveland State University, and I am currently practicing at Baldwin Wallace University. Also, lover of steak fries.
Well, I'm indifferent to steak fries. And Elliott, every time you speak into the microphone, we get a nice full shot of your forehead.
Oh, yeah, because I'm trying to speak into the mic. I'll pick it up.
Okay, thanks. But Britt, you've got the first.
Nothing to write home about. It's just getting large. Not because my brain's growing.
Yeah, there's plenty of real estate there. Britt, you've got the first question.
I want it on the record that I would like some steak fries now that they're perfected. I also made a pretty perfect banana chocolate bread today. It's pretty darn good, if I do say so myself.
I'm sensing a Circular Firing Squad potluck.
That sounds like a plan.
Dig that.
Okay, so my question this week is, what is the most challenging professional experience you have encountered recently?
And I'm not trying to be a Debbie Downer here, but oh boy, at university where I work, they're doing all of these cost-cutting things, and I get it, but they're not looking in the obvious places. And I was in administration for 10 years. And I know how to read a budget. And laying off staff people and hiring vice presidents is illogical. Vice presidents, yeah, you can get rid of them at a moment's notice, but they're all like overpriced. Staff people are underpriced, and we desperately need them for day-to-day operations. And they're reorging. And we were in this new school meeting, and they wanted us to introduce ourselves. And I'm like, well, 2 years ago, we were all in a college together. Why are we doing this? So I introduced myself, and they said, where are you from? And I said, what do you do? I said, I'm a counseling professor. What department are you from? And I said, I'm from the recently euthanized CASL department. And everyone thought that was this big downer. And I'm like, I'm sorry, I didn't want to put it down. I didn't vote to put it down. Someone took that department to the vet without my approval. So, that's been really challenging, because I feel like balancing a budget is not that hard. You just have to make hard choices early on. And if you don't make them early on, you make harder choices in a medium state, or you make catastrophic choices at the later state, but you have to do it. All the money at university is tied up in personnel, like 80% of it. You're going to have to cut personnel, so you have to cut low-performing programs. And yet, I am not hearing anybody speak logically about this, and it pains me deeply. It's worse than having acid reflux in the middle of the night.
So I wasn't exactly sure, because I was thinking about, like, it's the keyword was recently, and I was like, well, how long can I go back? And I'm like, has anything like happened to me? And then I'm like, oh, yes. And so this is something that happened, so I had a practicum site working in private practice, and I switched to a college counseling center, not because the practicum site was bad or anything, but if you're a counseling student, right, you can get an internship only site, and then you need a practicum site for summer only. So I was really happy to have my practicum in private practice. Learned a lot. It was a good experience. Now, of course, the one thing that I have experienced that I think is perhaps a little sooner because of this is termination, which we desperately need a word that is not termination inside of counseling. And every time I say termination, I will bring up that we need a new word for termination. And one of the things that I wasn't sure about was how I was going to respond to termination. And so I've heard before Some counselors say like termination is like their favorite part of therapy because they get to it's sort of this restorative moment for clients and their autonomy. And I understand that. And for me, it's not my favorite part of therapy. In fact, it's one of my least favorite parts of therapy because it means that connection is not in person, right? And so I can still like remember those like memories and think about that person, but I don't have that. There's not that therapeutic relationship anymore, right? And so it was really, I remember getting a little emotional as I was sort of like saying goodbye, and sort of like finishing those sessions. And I think it's okay to have that experience, because I think it means something to have a connection, even if it's through counseling, right? It's not necessarily like I'm obviously not going out and like being friends with, my clients or anything like that. But I do think back on those memories, and I'll certainly never forget, right? Like my first set of clients. And so that was definitely something that I expected to be challenging. Right? Because you have the process of not just terminating that last appointment, but right, like we talk about termination for several weeks beforehand about like, how is this going to happen? Right. Like knowing that I'm moving on to a new practice and either like we're sort of like done with counseling, we sort of achieve some goals, or referring to a different clinician, et cetera. So that was something that was definitely like an expected challenge for me. And it definitely is not my favorite part of termination, definitely not my favorite part of counseling.
Mitch, it's something we should talk about at length, because I've always wondered about that when someone does a prac. It's such a short experience. But yeah, if you get a college counseling center, you definitely want to do that site. I get that. But it's almost like, wow, yeah, it would be great if we had another way to, I don't know, tack on to the site you're going to, because you do have to deal with all the emotional sequelae of forming relationships, leaving, and then starting anew. But sorry, it's
a great point.
Privilege of instructing Mitch's prac section, so I wondered about that because it's tricky.
Yeah, it definitely is. There's also the idea of like I met a ton of people at the prac site that I was working at, right? Other clinicians too who supported me along the way, had, switching supervisors too. And so that all sort of like changes right before the start of the new semester, right? Just got onboarded Monday and just finished up prac on Friday. And so now we're, jumping right into counseling at BW on Monday, right? It's kind of, it's intense.
And listeners, stay tuned for a Circular Firing Squad special. When did onboarding become an actual word? We'll explore it in depth in an upcoming episode.
We start streaming and Elliott just starts to go off the deep edge. I mean, there's someone crying inside that wants to get out.
I didn't swear.
Yeah, you kept it clean. I appreciate that. This is an easy one for me. Most challenging professional experience recently is taking over the role, at least I've got to be honest, half the role of being program coordinator. The other half, which is anything practicum and after, is being taken over by another faculty member who's done that. So it's comfortable. But I got the beginning of the program. So I got all the applicants, I got all the courses setting up, I got all the adjuncts, I got all the student complaints, I got the statistics, I got the admissions. So within this week, I always looked at this position and thought, sometimes, and good friends of mine have been in this position, sometimes these coordinators, it just doesn't seem like they care. It seems like it's not as big an issue to them as it should be. And I thought, wow, they're kind of insensitive. Well, I got a touch of that this week because in one day I upset the administration for not doing something with the database that I don't have access to the database for, but that's supposed to be my problem. I upset a couple of faculty members, I think, who had made some decisions about opening up their classes or leading a couple of students to believe that they could get in when there is a wait list. And that came back to haunt them and me. And then I upset a student who wanted to do all this switching around and couldn't because of the section wait list. So it was a trifecta of disappointment this week that I managed to pull off. I don't know, besides my family, I don't know if there is anybody else in my life that I could have pissed off. So that was the most challenging professional experience.
Well, as a fellow grad coordinator, Marty, I can certainly empathize with you and have been there for several years. I would love to tell you it gets better, but here we are. I'm still doing it though. So either I'm a glutton for punishment or it is survivable, maybe both. Good luck to you continuing in that. So I don't really know where this question came from because things have been fairly even for me, knock on wood, for a minute now. Certainly I can think of experiences I wouldn't necessarily call recent that have been challenging, but I think most immediately what comes to mind is school starts tomorrow, and normally by this time of the summer, I miss my students. I'm excited to go back, and I am just not feeling it right now. Sorry to any students who might listen to this, but I wouldn't necessarily say I'm at a point of burnout, but I am scared that the feelings I'm experiencing could maybe lead me in that direction. And I have been there before. We all know that's not fun. And I don't really know, I feel okay about going back to school, but I don't really know how to tap into the energy that I normally would have, or the excitement that I normally would have. My therapist this week offered me a really interesting reframe. I've been working a lot on balance and self-care in my life. And she said, maybe it's not something that you should pathologize. Maybe it's not that you're not excited. Maybe you just have other things going on that are taking some of your energy and happiness and excitement. And maybe that's true. I don't know. I think I need to reflect a little more on that. But as grad coordinator, I'm responsible for our orientation, and I did both sessions this week, and normally that gets me up and going, and it just wasn't happening. So wish me luck this coming week. Hopefully it kicks in.
All right, I think I'm up. Pick up the mic. Don't show your forehead. It's not a very flattering view. If you were an organ in a body, I got this, I was rewatching Fight Club, and this was kind of inspired by a scene in Fight Club. If you were an organ in a body, which one would you be and why?
I have so much to say about this question. Things that I didn't know that I would want to say. I just watched Fight Club for the first time like a week ago, or like maybe it's a little bit longer than that. But I was like, where has this been all my life? This was not at all like what I was expecting. Like,
where have you been?
I know.
Come on.
I know.
Talk about Fight Club.
It was like, it's so like, dang, what a great movie. Sad I missed it, but happy that I didn't. So I must confess that I never took a graduate level biology class, and I rarely took I didn't take many like science classes in high school. And so this question, of course, came with some sort of existential crisis. The first being, aren't I all the organs in a way? And also, what is and what is not an organ? So I had to like hop onto like Wikipedia real quick, and I'm not even sure if this information is accurate, because like it says like teeth is an organ. Like, are teeth, is that an organ? Like it like lists this. Like a tongue is an organ. Like that makes more sense. The teeth is like a little strange to me. I can think of like organs that I wouldn't want to be. Like I wouldn't want to be like lungs. It feels like sometimes like I get, like I'm swimming now, and sometimes like I get a minor amount of water in my nose, and I'm like, I'm drowning. I'm about to die. And we're getting over that. But I think that, I do really identify with being the brain, assuming the brain's an organ and Wikipedia is correct here. I think there's just like it's hard for me to pick something else, I guess, because the amount that I feel like the brain can do versus like the amount that like lungs can do, or like a heart can do. Like I feel like if I was a heart, I would just be like, I'd just be beating for 80, 90 years or something like that, and like that would be my existence. And I don't know if I would like that existence. I don't think that I would like to be teeth. That sort of like doesn't feel like a good existence for me either, because again, is the question like, is it only one organ, right? Like I wouldn't want to be like the kidneys. I wouldn't want to be like, the liver. There's like so many other things, and I'm just like, I'm just gonna stick with the safe answer here. Go with the creative, wonderful, awesome brain, and we'll chill with that.
Organ is a group of tissues that work together to perform a specific function. So, yeah, teeth would be inclusive. You might think of an organ as like just this one mass that's separately differentiated from everything else, but no. I am Joe's spleen. That is, and I've got to tell you, it is from Fight Club, but it really is from Reader's Digest, which used to and maybe still has a monthly representation of Joe or Jane in some cases, various organs explaining the purpose of organs. So I am Joe's spleen. The reason I say spleen is it removes old damaged blood cells and helps control the amount of blood and cells in the body. It fights germs. It stores blood and iron when necessary, and it also helps with the immune system. And particularly why I am Joe's spleen is last week my dog had their spleen removed.
Oh,
In kind of emergency surgery, and that's an 8K surgery right there on a dog. So spleens have been on my mind and in my bank account recently. So I am Joe Spleen.
All right. Well, I'm super bummed because you took my answer, Marty, but I'll still give my explanation. I tackled this question, which I love, by the way. Thank you, Elliott, by ruling out what I definitely wasn't. And that was a really fun and interesting process. And where I landed was spleen. And the reason is because I feel like as an introvert, I often just sort of keep to myself and fly under the radar. We don't hear a ton about the spleen. It's not our first go-to organ that we think of. Teeth is usually mine. But I'm definitely not a liver because I have no filter. And the spleen, I think, shows up when it needs to. It fights infection. So I think that I show up when I need to. I do my job. And other than that, I'm comfortable to just kind of stick to myself, fly under the radar.
these are great answers. I love all of them. But for me, definitely a liver. I'm a liver, and I'm a liver. Because I've cleaned up a ton of messes I never got any credit for. This is a wee bit of sour grapes, okay, but I was happy to do it. But I cleaned up a lot of messes that I never got any credit for. And many of my family members have been blessed with Keith Richards type livers, which, we have to be mindful of that. But so the liver's always been a little bit at the top of the list because I was always impressed at what mine pulled off. So I thought, well, hey, liver's, a strong cleaner upper. I'm just a wee bit like Mr. Clean without the earring, maybe. That's okay. But yeah, it was the liver.
All right. Yeah, that was a fun question. So mine is, what are your thoughts on EMDR?
Boy, I'm going to get in trouble here. I think as I spend more time, and I teach theories, I teach advanced theories right now. And you look at the history of how it was developed. Eye movement desensitization and reprocessing is what we're talking about for folks who are in. And it is used and helpful for folks. But to me, and this is where I sort of am with my approach to theories. Anything that turns counseling into a mechanism. I'm talking to you, CBT, and I'm talking to you, DBT, and I'm talking to you, EMDR. Takes the humanness out of the experience and turns us into technicians. So I don't have to filter anything a client's really saying. I just need to do the voodoo that I do to make whatever happen or whatever handout I'm about to give them happen. So EMDR falls under that. I know people who swear by it, people who love it. I just can't see my professional life spending time wiggling my finger or tapping on something or using some gimmick to get people to talk about something deeper or re-experience something deeper. It's expensive, it's controlled, and it's the training is available, but is also It's like Fight Club. Once you have the training, you don't talk about the training. It's kind of a specialized little group of folks who seem to, whenever I talk to people who are trained in EMDR, they seem to, there's that kind of 30,000-yard stare that they have when they look at you talking about it. So,
And they don't blink.
And they don't blink, yeah. So you asked me my thoughts on the EMDR. That's my thoughts on EMDR.
Thank you.
Do you teach it as a theory, Marty?
I don't teach it as a theory. I teach it as a process or as a procedure that people use. Now, I guess I could walk that back and come up with some theoretical orientation, but there's a lot of not knowing what happens if it's activating mirror neurons or other sorts of things that are going on. But it just seems too mechanized for me to be something that I would ever want to do. And that's my filter on it right now.
Yeah, I was curious because I teach theories too, and I refuse to teach EMDR as a theory, although I certainly will talk about it in a technical way or as an approach, similar to some other things that we're doing in the field now. 2 years ago, my answer would have been very similar to yours, Marty. And then I experienced some trauma and was diagnosed with PTSD and went through EMDR as a client. I will not say that it completely changed my life, but it really was more effective for me from a client perspective than I ever expected it would be. And so I give it more credence today than I think I would have. I know I would have a couple years ago. I still don't think as a practitioner it's the right fit for me. I can't see myself facilitating it either. And I have some fundamental disagreements with the way that the training is offered or the lack of its accessibility for folks who are interested. But I also can't deny that there are parts of it that worked for me. And so it was a really good learning experience for me, if nothing else, and energized me a little bit around having to teach it. So
yeah, and I echo what you're saying, Britt, because I was in treatment for trauma, and the counselor that I was treated by, who I still see as a kind of PRN basis, but I had a bridge phobia since early as I could remember. I was in preschool, and we got a new freeway that went from the suburb to Youngstown, and going over this bridge, it was much higher, and I just freaked. And I had no idea why, but I always freaked on bridges. And I was driving my Harley over the I-80 bridge, and all of a sudden I was hovering about 6 feet above the motorcycle, and I thought, this is not good at all. You need to get this looked at, because I had to pull over, like literally. It was intense. And my counselor, I did not know about EMDR, and I think that's important. But she treated me with the paddles, and we did a couple sessions, and it went away. And I was driving my bike over any bridge I wanted to, and I was like, wow, that's fascinating. But I honestly didn't want to dig too deep into it because I didn't want to undo what had been fixed. And I also thought of it as a technique. I didn't really see a theory, but I also taught the history of psychology in our doc program a couple years. And I know Freud, he had a couple of these things. One was the temple push. He would push on people's temples. And the other was tapping their forehead like energy psychologists. Woo! I mean, and don't even get me started on energy psychology. That's a whole other thing. But it was just like, it's a distraction. And Freud said, I think it's just a distraction. I think it was in the introductory lectures on psychoanalysis. And I thought, well, yeah. But if I'm distracted from something and I'm able to process something in another part of my mind, brain, my body, well, that's great. So, like you, I have... I think of it as a technique. I don't think we understand what it is, and I don't think it has to be paddles or energy psychology. That I'm not saying that EMDR does that, but I think it's just distraction might, in fact, loosen up certain defenses that allow us to then access things that are psychologically painful. We can make them objects of psychological awareness and perhaps engage in recovery with that technique. So yeah, I look at it as a technique. But hey, good for Francine Shapiro. You know what? Everyone's got to get tenure, right? We got to publish stuff. We got to try best. And I thought she's made a really legitimate offering. And I'm not saying it's ontologically some important thing, but I'm saying it helped me, just like Britt, you said. But I was like, yeah, there's something there.
What I like most about it, Elliot, is you just informed me a little bit about Freud's engagement with it, because you tell anybody, any modern practitioner, that Freud came up with that first and watch their head explode.
Oh, most people don't read their history, and it pains me. It pains
Yeah.
me.
Yeah. Thanks everybody for your answers. Dr. I, you said the word distraction, and it makes me kind of think of something similar, sort of like game therapy for adults with trauma, or even kids, but sort of like game therapy or art therapy, or some of the different like creative therapies that can like provide people with something else to do while they're like processing stuff. And so that's kind of interesting to me because I'm not 100% sure why it works. For me, it both kind of like works and doesn't work. And so I've experienced some benefit on it, but the challenging thing is, even though I have an excellent therapist who's like very, I think practiced in providing the therapy. I haven't had a lot of times, like when I walk out of session after EMDR, I'm not in a good mood. I am in fact in a bad mood. And that's, I think, the thing that I'm like really surprised about is like nobody told me that, right? That could happen. And like I talk to people all the time who've like received EMDR treatment, and a lot of them say like I walk out and like I'm not having a good time when I walk out. And I think this is something that does, and I'm not someone who like is seeking like further EMDR treatment at this time. I don't know if I would ever need to.
Mitch,
Yeah.
Watch your email blow up now.
If it's actually that bad and people are that defensive about it, I'm sort of like, I'm questioning, right? Because I think we can very clearly see in the clinical research literature, the dropout rates for EMDR, and the dropout rates for EMDR are significant. And, I was not told about any dropout rate, but like, if you have a 1 in 5, 1 in 4 chance in a clinical trial where everything is meant to make the theory and the intervention look as best as possible. If you have a 1 in 5 or 1 in 4 chance, which is what we see for EMDR dropout rate in clinical research trials, and as the trauma sort of like proceeds from, as you sort of get into like, it's even higher for something like CSA, for people who've experienced CSA, like even Kolk's study, right? Like Kolk did a study on EMDR, dropout rate 27%. And the concerning thing to me is that, and I've mentioned dropout rates before, the concerning thing to me is that we don't know why people are dropping out. They don't measure it in these studies, right? And so you can look and check of like, okay, like why did a third of your cohort or a quarter of your cohort in the study drop out and there's no reasons for it? That to me is really scary. And it's scary enough to like, as someone who came into the field, in graduate school, heard about EMDR and was like, oh yeah, I'm totally going to get practiced in this. And I'm going to start reading about it. I'm going to start reading the research trials. And I read the research trials, and it's like, if the dropout rate is 1 in 4, I imagine it's higher out in the counseling world where people are actually doing the work, where it's not in a clinical trial, right? And it's the same kind of thing with CBT, Marty mentioned CBT too. Not CBT too. I don't think there's a second version of CBT on the way. But the idea of right, like if CBT's dropout rates are even higher than EMDR, right? And so that to me is really concerning of like, to me, I'd want to be able to tell my client like, hey, there's a 1 in 4 chance you might drop out, because that's what we know is happening inside of these clinical trials. I think clients deserve to know that. And so like, I sometimes hear people who like do swear by EMDR, and it's like, I don't care how good of a practitioner you are, you're going to have people drop out. And I'm interested in, that's typically what I've been, reading about, is like, why are people dropping out of EMDR? And I sort of think back to, I really don't like how I feel when I walk out of session, right? And there are some times where it feels helpful, sometimes where it doesn't. It's been a mixed bag for me. I'm glad that I did it, certainly. But yeah, those are my thoughts on EMDR.
I just, Mitch, you triggered a lot of thoughts on my behalf. My first one was, I saw my counselor for 2 years before she used the EMDR on me. And I'm listening to you and I'm like, oh, if I'd have just gone in and she said, okay, we're going to deal with your trauma or your bridge phobia, whatever.
100%.
But it's like, I already had that robust relationship with her, and I would credit that with at least part of my recovery. But you raise an interesting question. We should talk more about this. This could be an article.
Absolutely.
Okay, my question for tonight is simply the question that you got from someone this week that gobsmacked you.
It's really unfair that you're asking this before the semester starts, because I guarantee you as of tomorrow, I'll have 400 answers to this question. Tonight, the best answer I can come up with, which is kind of embarrassing, is this lady I fought back and forth with all week on freaking Facebook Marketplace. I don't even want to talk about it. I'm so upset. She first asked me to decrease the price of an item that I was selling. And I said, sure, who cares? That's fine with me. I just want to get rid of it. When can you come get it? She then proceeded to change the pickup time 6 times throughout the week. And I finally said, I'm just going to relist it. Have a nice life. Thank you very much. And she went away. And then today she came back. I was in a good mood. We set up a time, and I'll be darned if she did not ask to reschedule again. I'm going to lose my mind for like $15. I just want to give it to her at this point. Like, can I bring it to you and set it up for you and pay you to take it off my hands? I'm tired of talking to you. That's all I got. Come back tomorrow.
This is like a whole series of short stories we could write about Facebook Marketplace. There's a market right there, right? Yeah, mine. Okay, I had the privilege of I play in one of the bands I work with is Hannah and the Patriarchy, and we played at the Haymaker Farmer Market this past weekend in Kent, and it's always a lovely gig. But there was this kid whose dad ran a stand, and there's lots of stands there. But this kid, he was kind of awkward and he was kind of out there, but he ran right into the middle of the stage. As soon as we finished a song, I think it was like the 9th or 10th song, and he started saying, do you want a slushie? He grabs me. He's like, do you want a slushie? He's a little kid. And I'm like, I have not thought about it. Give me a second. I'm old. He's like, okay. And then he grabs the singer. He's like, do you want a slushie? And then every break we took, this kid's coming up. My dad says donuts are coming, but they're not there yet. Do you want a slushie? And we were joking because I said, 30 years from now, there'll be like a biopic or a documentary about the greatest salesman in the world. And this will be the first scene. He's running up saying, do you want a slushie? And it was wonderful. Kid was brilliant. I eventually said, hey, my man, you're intruding on the sacred space of the stage. But we like you. You got chutzpah. So it's okay. But you need to wait till we finish our set. But it was great. And so it was kind of gobsmacking, but it was just a hoot. And I enjoyed every moment.
Did you get a slushie?
Yeah.
I did not, because I am losing my battle with my weight management goals. I'm wearing the Steven Seagal outerwear for men who have given up on weight management. Everything's black. I'm just trying to hide the fat now. Ingersoll men, we get stealth fat. It's really creepy. And like even your forehead's kind of fat, And then I got this when I first had my knee replaced, and I said, I know what's coming. I know what's coming. It's the fatalanche. And the fatalanche happens in the middle of the night, and you just hear, whoo, and then you wake up and your forehead's normal, your nose is normal, but your belly is really big. That's where I'm at now. I'm trying to lose it, but without having access to running, wow, is it hard. Bit of a tangent there, but for those of you thinking about knee replacements, don't let that stop you. It's worth it.
We have seen a lot of your forehead tonight. I'm just saying.
Yeah, it's normal. If you could see the belly, though, you'd be like, oh my gosh, that room's going to collapse.
I'm not, I don't think I can follow this answer up. I don't think I can follow this answer up, but I'm going to give it a shot. So the question that has been on my mind this week, quote unquote, it's in the week, so it's fine, is if you were an organ in a body, which one would you be and why? And the reason that this gobsmacked me is because I'm still thinking about it. I'm still thinking about the fact that teeth are organs. Like, that makes no sense to me. And I'm reflecting back on like my biology education. I feel like I've learned quite enough. Never really enough, but I've learned a ton about the brain as an organ. And so I am very familiar with the brain. And so I'm sort of thinking of like outside the brain and maybe the central nervous system. Where am I? Where am I in terms of my biology education? Did I just like miss out on that because I took geology, which was like, I mean, I almost said the class rocked. That would have been bad. but I really appreciate like, taking, geology. That was fun. I think I took like science of cooking and flavor. Like those classes were like more relevant to me. Like, do I need to know the teeth are an organ? No. Right. And I'm going to be trying to figure out if that's a lie and someone just inserted that on Wikipedia. Like I know it's an organ, and also, is it?
Okay, Mitch, it's not the question, it's the answer you don't like. Yeah. Yeah. Okay. Well,
That's
we can
true.
agree upon that.
That's a good point.
The question that I got this week was after a series of attempts for a student trying to get into a section for a class. And I went through a whole series of trying to find out who's on the wait list, who gets to get in first. The kid can't jump the line, only to find out that he was already in a section of the class. He just wanted to go to another section. So it was maybe it was the answer that gobsmacked me more than the question. But the question led to me having to find that answer out. It's like I spent a day and a half. You called me and left a message on my office phone. You sent me an email. You sent me another email, only to find out that you were already in the section of the class that's co-taught with two instructors who work together and basically do the same content and the same activities. Yeah. So that was, so can I get into this other section? Seems like a simple request, but like I told you earlier on in the show, this is all new to me. So final shot question. Worst spam or email message that you've gotten?
Research requests, make it stop.
Research requests? What do you mean? Oh,
Wow.
to do somebody's research?
Yes. To be fair, I send those immediately to my spam. So I'm thinking of them as spam because they come through my junk folder now, which I check regularly. It's too much. I can't. I'm done with the research requests. I know I'm a terrible counselor educator. That's fine. Everyone already knows.
I actually went through my spam just to check this out. And my favorite, probably the worst, is we have journal, you have paper. Let's connect. It was for one of those for-profit, open access.
Oh, wow.
Part of me was like, heck yeah, let's connect, mother trucker. I'm fine with that. All of those words are fine, Marty. Don't worry about any of them.
Yeah.
Canadian. But yeah, I was like, gee, I'd like to be wooed a little bit more, but hey, take what you can get.
So I went to Cedar Point. Was it like earlier was it this summer, last summer? I don't remember. I think it was last summer. I got this message while I was at Cedar Point that like my car, because I had like parked at a friend's house and we had carpooled, and I got this message that my car had been like taken to like an impound or like a dealership or like it had been towed or something like that, and it had been taken to a dealership like 45 minutes away. And I knew this was fake. And yet, right, the entire day I'm like sitting at Cedar Point and I'm just like, it's running through my head the entire time of like, what if this is not fake? What if my car is in Stowe, Ohio, and I'm going to have to figure out how to get over there somehow after I get back from Cedar Point at 11 at night? I don't want to do that. And then it just like it wore on me the entire day, even though it was like so obviously spam. You sometimes get those spam texts and they've got a bunch of like dashes and semicolons and parentheses and things that shouldn't be there, and for some reason they are. And then like it was a good day. It was a great day at Cedar Point. I really enjoyed myself, and the entire time in the back of my mind, it's like, what if your car did get towed? So, but it didn't. It was there the entire time.
Well, mine has to be any ad that I get for Wegovy, Mounjaro, or Ozempic. And I say that because I require those medications and I can't get them. They're just not available for type 2 diabetics. You can't, and they keep doing those damn commercials over and over and over again with the dancing happy people, and I can't get that. So when I get those spam messages, when I get those, some of them are like they're just phishing. They're just trying to take money, but some of them actually come from the drug companies, and it's like, I got a bone to pick with you. Don't send me advertisements for drugs that are unavailable for me to get from my pharmacist because they're so well advertised and so overused at this point that you can't keep up with demand for the people that actually need it.
And Marty, you're right about this. And this is the 30 pounds overweight Dr. I talking. I see those commercials and I'm like, no, Marty would be even more pissed. Don't do it. I won't do it. But it's tempting. I get it.
Yeah, it is. It's tempting. And I can't even get up to what I can get. I can't get to a therapeutic dose. Enough said about that. Well, let's thank the firing squad. Got to thank Elliott. Got to thank Britt. Got to thank Mitch for joining us tonight. And look for some of these characters on their podcasts on the podtalk.net. You can find out more about them at circularfiringsquad.net. We're missing a few folks. We're missing Steph, who's out this week, and she had a late appointment and could not make it back in time for the show. And we've got Eric, who's, I think, doing baseball. Or one of his kids involved in sports through October, and Gina, who's off for the summer. So would love to see a full group of squad coming back. You can find out more about everybody on circularfiringsquad.net. Make sure and check out the Tech Savvy Professor podcast hosted by Eric and myself, and also Vision Profiles, a podcast about Apple Vision Pro. We are now officially, I think, on YouTube. So you can find us anytime you want to find us. The podcasts are available there, and these video recordings will be available there at youtube.com/@CFS podcast. So find us there, and we're hopefully going to invite some guests in and have some more live kind of show experiences with people joining us coming up in the fall. It's exciting to get back to school, and it's exciting to get back to Circular Firing Squad. So thank you for that. Our theme music is from Menage a Quad, Real Swing Shet. That's it for this episode of Circular Firing Squad. Ready, fire,